So as you go through those, just keep that in mind about there are things that should make sense, even here when it's all about memorization. It should still kind of make sense. Let's take a look at, I think we end it with fibrocartilage and elastic cartilage over here. The next one is bone. With bone, I want us to think, that it is a category of connective tissue, bone is, right? Secondly, this bone is also going to be important. Sorry, I was trying to move this, so I think it's too close, that's the only problem. Bone is also important for, right, to understand that we have more than one type of bone. The types of bones we have, spongy and compact bone, those kind of bones are going to be important for different types of areas that we do see bone, right? So have you heard of a bone marrow before, bone marrow transplant? Well, bone marrow transplant, you're not going to transplant the actual, when we have a bone marrow transplant, you're not transplanting the actual cells, right? Not the bone forming cells. We want to transplant the actual stem cells that allows us to make red blood cells and white blood cells. Those are the cells we want to transplant. Well, those cells are not found in compact, dense bone. So we have two types of bone. One that we saw before, that bone that we saw before looked like tree rings. That's a dense, compact form. Then, usually at the ends of our long bones, or internally on some of our irregular shaped bones, we have spongy bones. Spongy bone looks kind of different. So here's our dense compact bone, right? You have this central canal where the blood vessels are, and then you have a lot of these little dots, long dots right here. Those dots are actual bone-forming cells called osteoblasts. And then once they're kind of surrounded by its matrix, like we see here, they turn into osteocytes. So the cyte cells, C-Y-T-E-S, those cells are the name of the cells once they're kind of trapped by the matrix it produces. So here, these cells are stuck in bone tissue. The matrix is real dense, real thick. Obviously, these cells will not be able to move anymore. It will not be able to wiggle around. It's trapped in its own matrix. And that matrix is dense, tough, and more importantly, non-giving. There's no movement really in that area. So once it has formed the matrix and trapped itself, it's a mature type of cell we call osteoblasts, osteocytes. Now, if you look at spongy bone, you don't see rings at all. Instead, what you'll see is areas that look like they have open spaces. And those areas that look like they have open spaces where there's no bone tissue, well, those areas are where we'll see our bone marrow, our stem cells that will turn into, eventually, all the different types of white blood cells. So we only have red blood cells, and they're only one type. One red blood cell is the same as another. White blood cells, there's a lot of different types, and they fight off a lot of different types of microbes. Some are very good for bacterium. Some are good for viruses. Some are very good against fighting off parasites. So all those different cells for white blood cells are all produced by spongy bone in an area where we have red bone marrow in that spongy bone. Again, when you take a look at this, you'll notice that the outer edge of our femur, right here, contains dense, compact bone, thick, strong. And then the inside contains spongy bone. And that spongy bone is where we will actually get the bone marrow. So you guys have probably heard about how difficult it is to actually go in and harvest the cells for bone marrow transplant. It's one of the reasons why people don't offer themselves as donors, is because it is something that is painful, and you actually have to go into the donor's bone tissue deep inside. And it's not a fun thing to go through, but it can save somebody's life. But nobody, it's not like giving blood where it's just tap it there, that's it, right? Very easy access point. With bone marrow transplant, you have to go through this hard layer of compact bone that covers the actual bone marrow and the spongy bone area. So that takes a lot of work, also causes a lot of pain. Now, in terms of bone, it's going to be very, very similar to cartilage. And we're going to see when we're growing, it's actual growth of cartilage that allows us to grow in length of a bone. So there's this huge relationship between the two, between cartilage and bone. And when we are first conceived, until you're about 4 months old, almost all of our bones, all of our long bones, almost all of them are going to be made out of cartilage. And then we slowly replace it with bone tissue over the last 2 trimesters. And if you think about it, it kind of makes sense why. In terms of bone, we have an organic material that's very similar to cartilage. The material that's organic is basically collagen fibers with proteoglycans right? So remember the proteoglycans and hyaluronic acid? So you have hyaluronic acid and proteoglycans as well. That extracellular matrix material is going to be very similar to what we see with cartilage. So we're going to see a lot of collagen in cartilage. We're going to see a lot of collagen in bone. We're going to see lots of polysaccharides and hyaluronic acid that kind of allows it to become thicker. Right? That's a sort of material found between the cell. Now, if that was all there was to it, it's basically cartilage. What we do in bone is we have an inorganic compound here. And that inorganic compound is what sets apart bone from cartilage. That inorganic compound is made out of hydroxyapatite, which is nothing more than calcium phosphate. So calcium phosphate, fancy name for it is hydroxyapatite. That gives a bone more density, hardness, and toughness. We talked about the 2 different kinds of bones, spongy and compact. Spongy bone, found deep inside our long bones, at the ends of our long bones, is found deep into our ilium, our hip bone as well. And that's usually where they harvest the cells when we do a bone marrow biopsy or bone marrow transplant, is we get the cells from the ilium. So it's deep, excuse me, in the hip. Now, the last one, in terms of connective tissue, is blood. Right? You would imagine blood. We went from something incredibly solid, like in bone, to something very liquidy in blood. So what blood has that makes it connective tissue is that it's found in multiple areas of the body. It's continuous. Now, it has a matrix and it has cells, just like all connective tissue. The matrix is made out of plasma. The plasma is a combination of lots of water, about 92% water, salt, glucose, and lots of protein. Now, normally we don't see lots of fibers when we have non-clotted type of blood. But if blood clots occur, what happens? Well, when a blood clot occurs, we're going to form something called fibrinogen and fibrin. That's fibers. Fibrin, fibers, kind of sound similar, right? Then we will see fibers. But normally when there's not a clot, we will have a lacking of fibers. And all we have then are the liquid portion that surrounds all of our cells. The matrix is formed by other tissues, unlike other types of connective tissue. In other words, when we look at bones, you have osteoblasts and osteocytes. Those cells make the actual bone matrix and the bone material. In cartilage, you have chondroblasts and chondrocyte. They form the actual cartilage material. Now in blood, we have red blood cells and white blood cells. We have platelets. They have nothing to do with forming any of the plasma that's carrying it. So it's kind of weird that way. Now most of the plasma that we have that are found in our blood is going to be found due to filtration in the kidneys, as well as, when we're going to talk about it in next semester, in our lymphatic system. we'll reintroduce some fluid there as well. Meaning that the cells that we find in bone make the bone tissue. The cells we find in blood does not form any of the plasma. Now we'll talk a lot more about blood. This is just a rough introduction. We're gonna have a whole chapter on it next semester. So just keep that in mind. Just understand that in terms of blood, this blood material right here, it is a connective tissue. The cells that are found there are part of our connective tissue matrix. Next, muscle tissue. Whereas connective tissue contains lots of different types, muscle tissue contains 3 major types. Sorry guys, right? Now all muscle tissue does one thing, and it is contract, and while contracting, it shortens. I want you to think about, like I use the biceps a lot because it's easily, you can see it, it's right in front of you. What happens when you contract the biceps muscle? As you contract it, you shorten that muscle. As a muscle shortens, it pulls on the radius and the ulna, and then your arm moves forward. In other words, you're shortening. We're gonna see that there's 3 main types: skeletal, cardiac, and smooth. And they have a lot of differences, but some of them are pretty similar. Between skeletal and cardiac, those 2 are pretty similar. Smooth is the only that it looks very different than the rest of these other 2. Skeletal muscles, and this could be a very good kind of like a written question. You can see in a second how a lot of this was highlighted. So know the differences and similarities between the 3 in terms of skeletal muscle, in terms of structure, and we will again talk more about it in chapter 8 and 9. For right now, I just want you to know the basics. Number 1, the basics is skeletal, cardiac, and smooth muscle. They're a type of muscle. They're not a type of connective tissue. They're a category of tissue by themselves. So far, we've talked about epithelial tissue, the type of cells. Then we talked about connective tissue. And now we're going to talk about muscle tissue. There's 4 different types of tissues. The 4th will be nervous tissue. So in terms of muscle tissue, there's 3 types: skeletal, cardiac, and smooth. So let's talk about skeletal muscles right here. Skeletal muscles are very long, unbranched, and multinucleated. The nucleus of each of these cells right here are pushed to the periphery, to the edges. And the reason why is because you're trying to maximize the amount of proteins that are found inside the cell. So the proteins we find inside the cell going to be a combination of 2 very important ones called actin and myosin. Their interaction, their structure is what gives us this light, dark, light, dark, light, dark appearance. That striation or banding is due to how those proteins are structured. And we're going to see that in a second, and we'll go into more detail later on, that those 2 proteins, there are also a lot of different proteins along with it, but those 2 proteins are the main contractile proteins. They're the one that allows us to move. And how they're structured allows us to have this light, dark banding or striations. In terms of these cells, the main purpose is to shorten with strength. All right, it moves the body's skeletal system. It's also going to control your muscles of facial expression. So in order to smile, in order to laugh, in order to close your eyes, to open your eyes, those are all caused by skeletal muscles. You control when you open your eyes in the morning. So that is a skeletal muscle type of behavior. We think that, it kind of makes sense that your muscles in the lower body and your upper body kind of makes sense. They're skeletal muscles. You control when you contract. But most people think that, in terms of the face, that there's no real control. There is control. It's caused by contraction of these skeletal muscles. Because of all the different controls we say we have voluntary, conscious control of these skeletal muscles. And then every now and then people talk about shivering. Shivering is uncontrolled, but the sole point of shivering is to increase your body temperature. Again, long branding or striated cells with lots of nuclei. Now these cells, once damaged, do not repair. So what happens is, we're gonna see cardiac muscles, skeletal muscles. If they're damaged in any way, let's say you get a real bad tear and some of these muscle cells die, there's no regrowth here of these cells. Cardiac muscles, very similar as well. Once you have an MI and a certain region of the brain starts to, a certain region of the heart starts to die off, that region of the heart will always have functional issues. So they don't regrow. You might survive it, but you will not be the same afterwards. Again, we're gonna see that the most common cause of death in an MI within the first 24 hours, most common cause of death is shock. You take out so much of the cardiac muscles from that blood clot that you can't eject blood out for the rest of your body. You're gonna die because of shock, no movement of blood. After 24 hours, it's gonna be caused by electrical issues, arrhythmias. And we're gonna see in terms of cardiac muscle, they're also striated, but how they're different from skeletal is that there's a lot of branch points. So this cell right here, it's gonna be branching out, making contact with other cells. And those branch points, where it makes contact with other cells, within those branch points, you have these real long lines right here. Those are intercalated discs. And they're found as connections between one cell to the next. Within those intercalated discs, you have gap junctions, which allows ions to move from one region to the next. As one cell activates, it receives a message to contract. It's then going to send that signal by passing sodium ions through gap junctions. As they pass through the gap junctions, it's then going to stimulate all the cells they're connected to. That allows then for one cell to communicate to other cells about when to contract. Keep in mind, we need to have this communication. If you don't, you'll have an arrhythmia. So we need this communication, and without it, we're gonna have an arrhythmia and God forbid something worse. When we look at these striated cells, they're very small and short. They're very branched, and because of that, they have real tight controls about where they can kind of pass that action potential next. Now, one other thing about cardiac muscle is that they're under involuntary or subconscious control. So you can't really force your heart to slow down when you're scared. That happens and your heart just races when you're scared. You can't control it. We're gonna see that cardiac and smooth muscle usually are under subconscious involuntary control. In some people though, when they are, let's say, doing biofeedback, right? You guys have probably heard of it. Biofeedback is nothing different than meditation. So they have tested monks in the Himalayas. And with monks in the Himalayas, they're able to control their body temperature even in the cold. So what happens is this. Smooth muscle allows us to have a lot of different movements internally in the GI tract, in the GU tract. It also is found in your arteries and arterioles. Now, why did I mention that? Well, I mentioned that because some of those monks can actually open up those arterioles. As they open up the arterioles, they can allow blood flow to occur in areas that shouldn't have blood flow. Right? When it's cold out, you shouldn't have blood flow going to the skin as much. So you're gonna have the retention of heat. But what they have done is actually monitored monks in the Himalayas, and what they did was give them a cold, wet towel to put over their torso. And their job is to meditate and see if they can dry that towel. So they're in the mountains, so you know it's gonna be really cold, like 20 degrees. And their main job at that point is to just meditate enough so then they can produce enough body heat so you can dry and get that towel warm, which is crazy. It should freeze on them, but somehow through meditation, They're able to increase their body heat. And they did this IR scan, infrared scan, and they showed their body temperature actually increased to 90 degrees. Now, their external body temperature, not internal. Normally, your external is like, mid-70s, that's it. So they're able to control it somehow through meditation. In terms of smooth muscle, these are the ones that look very, very different than the other two. They're non-striated, they're short and spindle shaped. Spindle shape meaning that they go to a very small point at the ends. They have the same proteins, actin and myosin, which allows for contraction and shortening of the previous two type of muscles. So we have the same protein, but they're not arranged in the same way. Because the arrangement isn't the same, it's not striated then. We usually see it in the GI tract, in the GU tract, and in the arteries, and in the arterioles. They usually regulate the size of organs. Your stomach is one big smooth muscle. It's actually 3 layers. Your bladder is smooth muscle. Your uterus is smooth muscle. So it regulates the size of what called the hollow organs. Then it forces fluid through tubes. Think about your urethra and your ureter coming in from the kidneys. Those are also lined with smooth muscle. The vas deferens for males, that's lined with smooth muscle. Controls the amount of light entering the eye. So your dilator pupillae muscle, your constrictor pupillae muscle, that allows you to constrict and dilate your eyeball. Well, that is also smooth muscle. Produces goose flesh or goosebumps, and under involuntary subconscious control. Locations found in hollow organs and blood vessels. The last type of category are nervous tissues right here. Now, in terms of nervous tissue, we usually think of these cells only, neurons. Now, neurons, they are the functional cells of your nervous tissue. But we're gonna see later on, and we'll talk more about it, even just kind of, just touch base on it, is that we have a lot more what we call neuroglial cells, support cells. They don't really have a function in terms of nervous activity. Their main job is to support, to increase the speed of a nervous impulse, to protect the brain. But they don't conduct an action potential. They don't allow us to connect the brain to the spinal cord itself. So in terms of neurons, these are the functional component of the cell. They have the ability to produce action potentials. Action potentials are what we're gonna call nerve impulses. So nerve impulse is an action potential. You guys have probably seen The Matrix before, and you've seen that, people try to, in the movie, the robots try to harvest our electrical activity. We do have a lot of electrical activity. And a lot of that electrical activity goes from your brain to the spinal cord through all the different nerves in our body to your muscle tissue. Now, in terms of the neurons, these are the only ones that can produce action potentials. The main large part of it, where the nucleus is called the cell body or the soma. If the soma dies of any neuron, if the soma dies, there's no repair possible, because you've destroyed the nucleus and you destroyed the areas that allows us to make proteins for repair and fat to reseal. The axon is a long cell process that will then carry action potentials to the next cell that they make contact to. There's usually one axon that exits out of the cell body, though it can split once they exit out of the cell body. In other words, there's only one that comes out, and then as it comes out, it might split to many other axons. So it can make contact with more than one part. The dendrite is the sensory portion of our neuron. This dendrite looks like little hair sticking out of the neuron, and this is where we receive nerve impulses from other cells. So if we think of a neuron right here, like we see right here, that neuron by itself is kind of useless. it's going to have lots of other neurons making contact with it. And then it's going to be part of a pathway with many other neurons it makes contact with as well. So usually with a neuron, it's that it has both a sensory part where it makes contact with other neurons, and those other neurons can activate this one neuron. And it has an active or motor part where we send that information to other neurons as part of our pathway. Right, the rest of this we'll kind of discuss later on. For now, understand what neurons are, that they're, and nervous tissue is a separate category of tissues completely. And now we have talked about all four types of tissues: epithelial, connective, muscular, and now nervous tissue. Right? That we only have four categories of tissues. Tissue membranes. We have mucous membranes, serous membranes, and synovial membranes. Mucous membranes, they line cavities that either open directly to the environment. So your mouth, your gums, your nose, your throat, right? Well, all of those areas have a direct opening to the environment. So you might breathe something in that's harmful. You might be eating a piece of fish and it's got bones in it. And what happens is you need a little bit more protection. So in terms of these mucous membrane, in the mouth region right here, we're gonna see, in the throat region over here, we're gonna have stratified squamous cells. Stratified squamous cells, very protective. And then on top of the stratified squamous cells, we have a thick layer of mucus covering it, protecting it even more. So this mucous membrane are mucus that lies over the cells, giving it even more protection. You got to remember, our body hates to have dryness. You guys have had it where your skin's dry, it itches, it doesn't feel comfortable, right? Well, inside our body, if we have dryness at all, it causes friction, inflammation, and eventually pain and infection. So we do not like any kind of dryness. So in the mouth region, in the throat region, anything where you have direct or indirect connection to the environment, you're going to have lots of mucous membrane lining it, acting to lubricate and protect. Now, if you look at the stomach right here, the stomach is way far away from the mouth, but it's indirectly connected to the environment because of the mouth and the esophagus. So there's even organs that are indirectly connected, have these mucous membranes. So if you've ever seen pictures of somebody doing an EGD, what happens when you do an EGD? You put that scope into the mouth, it goes down the throat, it goes into the stomach, and you should be able to see just how nice, pink, and slippery it looks. It should be that slippery. That slippery looking material is the mucus that is protective. Serous membranes are found in organs that don't have openings to the environment. So here in your abdominal cavity, inside your abdomen, that area obviously is not going to be connected to the environment at all. Internally then they have serous membrane, simple squamous epithelium called mesothelium. They line cavities not open to the exterior. They're found in the heart, they're found in the lungs. They're found in the abdomen with the peritoneal area. Allows for reduction of friction during movements of organs deep to the cavity. So in the thoracic cavity, we're gonna have a system of tissue here where we need to move the chest. As the chest moves, your rib cage moves, and your lungs need to inflate. So we have a pleural system that is embedded on the ribs. So most of you guys have cooked ribs before? Anybody's cooked ribs? Now when you've cooked ribs, have you ever looked in so there's the area on the outside where the meat is at, right? So you see all that meat on the outside. Inside in the rib, you should see like a white film that most people need to cut out. Now next time you cook, that white film is usually hard to remove. That white film internally seals the rib. So then there's no air that can go through. That sealant, that's what we call the parietal pleural. So that is tough connective tissue. And if you look at it, that sealant inside, it's not dry. It's nice and slippery. Why? Because it's a type of serous membrane. So next time you cook ribs, I mean, don't look at it, don't. Right? But you will need to remove some of the internal areas there, or else it's harder to cook. If you want ribs that are like, fall off the bone tender, then you need to remove that parietal pleural. By the way, that is parietal pleural. The last type of tissue membrane is synovial membrane, and it's found in our freely movable joints, like your knee joint, your wrist, your elbow joint, your shoulder, your ankle, your hip. Those are all freely movable joints. And within those joints, you have synovial membrane with synovial fluid. And that fluid is going to be full of hyaluronic acid. And it's going to be similar to engine oil that we put in an engine. It allows these bones to move around without rubbing against each other and breaking apart the cartilage. All right, we're not gonna talk about wound repair until next semester, so you guys can skip that part and won't be on your test. The next part is effects of aging on the tissues. Now, we're gonna say this a lot. Aging sucks. So everything about getting older is gonna suck. So what happens? Cells divide more slowly. Collagen fibers become more irregular in structure and may decrease in number. In other words, the areas that are supposed to be strong, like your tendons, like your ligaments, well, there's less collagen, and the collagen there no longer have the same strength. So the same fall that we would have as kids might cause us to break our hip or break our femur. Elastic fibers fragment, bind to calcium, and become less elastic, causing hardening of the arteries or arteriosclerosis. Now, there is a difference between atherosclerosis and arteriosclerosis. Atherosclerosis is fatty, plaquey deposits on the actual blood vessels. Arteriosclerosis is usually systemic, where the big arteries, the elastic fibers there that allows it to stretch when it receives blood from the heart, well, those fibers become less elastic. And because of it, you can't stretch that artery as much. There's a tendency at that point to kind of rupture, and that does happen from time to time. This would be the harder one to treat. Atherosclerosis, usually we can go through the balloon angioplasty, right? Have a little drill bit, kind of go into the coronary arteries, remove that fatty deposit, put a stent in there to keep it open, and then we're done. Right. Kind of easy, and most people even brag about how many stents they have. It's kind of crazy, but they do. So with arteriosclerosis, it doesn't work that way. These are the big arteries, and the problem isn't usually that you have a clot in there. The problem is the elastic tissue that helps form the arteries are no longer as viable. They're no longer as elastic. Think of a rubber band that that's older rubber band that no longer has that stretch. What happens if you keep pulling it? If you keep pulling it, it's gonna rip. Same thing here with arteriosclerosis. Changes in collagen and elastin results in arteriosclerosis and reduced blood supply to tissues, wrinkling of the skin, and this big one, increased tendencies for bone to break. Do you guys know that if you have older parents between the age of 60 to 75, if they break their hip at any time, and actually when you break your hip, you're breaking part of your femur, not the actual hip bone we'll talk about. If they break their femur, the chances of them ever going back to normal life is about 15 to 20%. That's it. So most people between 65, 75 that actually breaks a hip, half of them die within the first 2 years. Right? So we're talking about very dismal odds. And usually when we fall, let's say it's very icy right now, if you would go outside right now, walk into your car and you fall, you're just gonna be more embarrassed than anything, right? You don't even check yourself out, you expect to be okay, but you just look around to see if anybody sees you. When you get older and you fall, you have a greater tendency for those bones to break. And you're looking around to see if somebody can help you up at that point. So there is a huge difference. Rate of blood cell synthesis declines in elderly. Because of that, they're more prone to infection. And injuries don't heal as readily, making them even more prone to infections.